Have you ever felt completely disconnected from your partner? Or maybe you've noticed that while your body could work, the desire just isn't there anymore. If you've been struggling with low libido, you're definitely not alone. It's one of the most common concerns medical providers hear, yet it's rarely talked about openly. Most people think the only answer to sexual dysfunction is a blue pill like Viagra. But what if the issue isn't just about blood flow? What if the switch that needs flipping is actually in your brain? Today, we're diving into a peptide called PT141. Some men call it their sex drive switch because it works in a way that traditional medications simply co-in. In this video, we're going to break down exactly what this peptide is, the fascinating way it was discovered, and whether it's the right solution for you. First, let's clear up the basics. What exactly is PT141? It's a peptide, which is a small chain of amino acids. Interestingly, it wasn't originally designed for sexual health at all. Researchers were actually studying it to help with skin pigmentation. But during those early clinical trials, something unexpected happened. Male participants started developing spontaneous erections, even without any sexual stimulation. This accidental discovery led scientists to look deeper into how PT141 affects the human body. They realized it was doing something unique. Unlike Viagra or Cialis, which focused on the physical mechanics of blood vessels, PT141 targets the nervous system, specifically a part of your brain called the hypothalamus. Think of it this way. The hypothalamus is the command center that regulates things like appetite, motivation, and you guessed it, sexual desire and arousal. To understand why this is a game changer, we have to look at the upstream versus downstream effect. Traditional medications like sildenafil Viagra or tadalafil Cialis are PDE5 inhibitors. They work downstream by increasing blood flow directly to the blood vessels. They help machinery work, but they don't necessarily make you want to use it. PT141 works upstream. It is a melanocortin receptor agonist, meaning it activates receptors in the brain linked to sexual behavior. In simple terms, it doesn't just help you function, it helps you want to function. PT141 is often prescribed to patients who have responded to lifestyle changes or hormone therapy alone. It resets the brain's connection to the physical response, which is incredibly valuable for those feeling a mental disconnect. One of the most unique things about PT141 is that it's not just for men. It works for women too. In fact, the only FDA-approved version of PT141 is currently an injectable specifically for women with low sexual desire. It's particularly helpful for people dealing with hormone imbalances or menopause, general burnout, and high stress. Psychological such as porn-induced arousal dysfunction or performance anxiety. Diabetes-related where traditional medications might be inconsistent. Consider the story of a 56-year-old patient with type 2 diabetes. He had been using traditional meds for years, but he felt they were inconsistent. He told his doctor, "Sometimes I just don't feel in the mood, even if my body is working." Adding lodos parte menos 141. His mental desire returned, and he actually looked forward to intimacy again. That's the power of combining the mind and the body. Now, we have to talk about safety, because there is a lot of misinformation online. You may say magic nasal sprays advertised that claim to be PT141. Here is the truth. The injectable form is the only one with solid clinical backing and FDA approval for specific uses. The nasal spray version raised safety concerns in early trials, specifically regarding nausea and blood pressure changes, which limited its approval for mainstream use. Common side effects of PT141 include nausea and flushing, headaches and fatigue, increased blood pressure. This is why you should never buy this peptide from unregulated online sources. Products sold online can be mislabeled, underdosed, or even contaminated. It is a powerful tool, but it must be used under the supervision of a licensed medical provider who can monitor your dosage and risk factors. If you're considering PT141, keep in mind it isn't cheap. Injections can cost anywhere from $30 to $80 per dose depending on your provider. If you aren't ready for needles or prescriptions yet, there are natural ways to support your sexual health. One highly recommended first-line support is watermelon extract. It's rich in L-citrulline, which helps increase nitric oxide levels in your body, supporting blood flow and stamina naturally. Closing. Whether you choose a peptide like PT141, a natural supplement, or lifestyle coaching, remember that your sexual wellness is worth prioritizing. Don't suffer in silence. Reach out to a specialist, understand the root cause of your concerns, and find the protocol that's right for your body. If you found this breakdown helpful, hit the like button and subscribe for more deep dives into men's and women's health. Thanks for watching.